This patient came to see me when he was 15 years old. In 2015, he was 15 years old. He came to see me with his mother when he was 15 years old in 2015 regarding teeth number 8 and 9. 2 years prior to that, so in 2013, he was playing baseball and he had traumatized both teeth in 2013, so number 8 and number 9. When in 2013 these teeth were traumatized, you can see they were cracked. So he was taken to his dentist, and his dentist had used composite to build those teeth up, but didn't do a proper examination, I guess. Didn't do proper examination, the dentist, so no endodontic treatment was rendered at the time in 2013. So when he came to see me, he had pain, he had swellings, he had pain. It was 2 years since the trauma. So you can see a large periapical lucency here. Look at tooth number 9. I'll show you a different angulation of tooth number 9. Tooth number 9 also had a large periapical radiolucency associated with it. So that's tooth number 9. And take a look at tooth number 9. Already inflammatory resorption in progress. Look at that. Look at all of that. Look at all of that. So tooth number 9 looks like it was traumatized a lot worse than tooth number 8, and the inflammatory resorptive process was already in full swing. You can see the large periapical lucency here as well. And here's the date. Options were discussed with patient's mother at the time. The patient was a minor at the time, so we discussed options with the mother. And options were not very good options because, again, 2 years had passed since the trauma. I was more optimistic about tooth number 8, but I was not very optimistic, of course, or at all optimistic about tooth number 9 because of the inflammatory resorption process already in full force and had already destroyed significant amount of tooth structure already. So, but patient was 15 years old. I mean, he wasn't a candidate for dental implants. And mother said, please, let's just go ahead and do these root canals. Let's see if we can get a few more years out of these teeth until he's perhaps old enough that if the teeth need to be extracted, and very likely, I mean, of course, the number 9 would be it for sure, then he's old enough to get a dental implant. So I said, fine, we can go ahead and do that. That's, discuss that option with mother. Extraction wasn't a good option for them. This is immediately after we did the root canals on these teeth. Tooth number 8, that's Gauropercha. And we temporized the tooth. Tooth number 9, because of the resorption, inflammatory resorption, I obturated the entire canal system with MTA. So this is all MTA, and you can see the resorption. I mean, it was just pretty advanced already in 2015. And again, the hope was to maintain this tooth, especially tooth number 9, to maintain these teeth, especially tooth number 9, long enough that hopefully by the time the teeth or tooth needs to be extracted, the patient is old enough to go ahead and get dental implant or implants. And here's the date. You can see 8 years ago, 2015, when endodontic treatments were rendered. This is a few months after we had done the root canals on teeth number 8 and 9. Patient came to see me a few months later, and all his symptoms had gone away, and he was very happy, and it seemed like everything was pretty stable. And we asked mom to bring the patient back on a regular basis, every 6 months or so we can keep an eye on these teeth and make sure that we're doing okay. And again, this is a few months radiograph of the teeth, a few months after we had done the root canals. And you can see how my concern regarding tooth number 9. Tooth number 9 was in pretty bad shape. And here's the date. This was yesterday. So hadn't heard anything from the patient, from the mother, for 7 years after we'd done the root canal. And just patient had fallen through. And didn't hear anything from the patient, or as I said, the mother, until yesterday. Patient came in and said, well, I'm 23 years old now, and I'm getting crowns for these teeth. And my dentist wants to make sure that the teeth are fine before he delivers the permanent crowns. But I have a bump on my gum on tooth number 9. And that's it right there. Right there. That's tooth number 9. Look at these temporaries. I swear to God, look at these temporaries. Look at the margins. Look, there's a hole in it. I mean, this is a 23-year-old good-looking guy. I mean, come on, man. You know, take some pride in what you do. You let a 23-year-old good-looking kid get out of your office with temporaries like this. I mean, we really need to do better. We need to take pride really in what we do. And I mean, this is just awful. Look at the margins, terrible looking margins. And you know what we always say, the way the temporary crown looks, your permanent crown will expect your permanent crown to kind of look like that as well. It covers a lot of things, this sentence, because it shows you the pride that the dentist takes in their work when they make temporaries. The same amount of pride and love and care goes into the permanent crown. So come on, man, you can do better than this. Come on. So this is another angulation, and you can see tooth number 9, it really is in pretty bad shape now. But it lasted this patient 8 years. This is 8 years after we done root canal on teeth number 8 and 9. The periapical relucency of tooth number 8 is gone, almost completely gone. Tooth number 9, we suspected to be in terrible shape 8 years ago. And, of course, you can see. But it lasted this patient 8 years, so it did its job. It lasted the patient 8 years. At the time when we did the root canal, the patient was only 15 years old. So he wasn't a candidate for a dental implant. He was still growing. Now, of course, he's 23 years old, and tooth number 8 now needs to be extracted. So he will have the tooth extracted now, and bone graft the area. His dentist will make him a flipper to wear for a few months until the area is ready for a dental implant. But everything worked out as we had planned. Patient, again, at the time was 15 years old when we did the root canal, wasn't a candidate for a dental implant, was still growing, developing. So now that he's 23 years old, this tooth can be extracted, bone graft, and dental implant. Tooth number 8, I still like to keep an eye on it for another few months. So I told the patient to go back to your dentist, have your dentist make you a flipper before tooth number 9 is extracted, of course. So you take the flipper with you to the oral surgeon, and when after the oral surgeon extracts the tooth, you wear the flipper. If the flipper needs to be adjusted, then you go back to your dentist, and your dentist will adjust your flipper to make sure that it fits well. And I wrote a report to the dentist. Please, you can do better than this. Make this poor kid, a good-looking 23-year-old kid, a better temporary crown for tooth number 8. So it also needs to match the shade of the flipper. That's going to be replacing for a few months tooth number 9. So the reason I want to keep an eye for now on tooth number 8 before it gets a new crown is because this is in 2015, so 8 years ago. You can see that really large periapical radiolucency. And this was just yesterday. Is that something? It's much smaller if I zoom out, but I just want to keep an eye on it. I just want to be a little bit more sure. So I'm going to keep an eye on this tooth for the next few months just to make sure that the tooth is okay before he gets a new crown. All right. But yes, that's what we have with these two teeth. Excellent. Take pride in what you do.